We have Dr. Amesh Adalja. He is from Johns Hopkins University. He knows all about COVID-19. Again, for people that are listening, I am vaccinated. This is not an anti-vaccine or a pro-vaccine segment. This is a factual segment to get out the facts of this virus and the vaccine. So, Doc, thanks so much for coming on. Greatly appreciate your time today.
Sure. Thanks for having me.
Can you talk about COVID-19 and why there was not a lot of early treatment for this virus? Obviously, it was all new, but why were there no therapeutics and medicines at the beginning of this?
There were no therapeutics and medicines at the beginning because it was a novel virus. We never had any coronavirus antivirals made in the past, even though we had threats from SARS and MERS. And I think there was an opportunity lost to develop antivirals. There was some antiviral development that went on, but it really was stunted. And that's kind of the story when it comes to pandemic preparedness, that it kind of goes through cycles. And because SARS and MERS were not in the headlines, people really stopped developing drugs. And we don't have any other drugs that were really specific to coronaviruses. And when it comes to viruses, it's important to remember they're very unique. It's not as if we have broad spectrum antivirals the way we have broad spectrum antibiotics, like an antibiotic like ciprofloxacin or Cipro, as people know. It can work on lots of things because bacteria have lots of targets. Viruses don't have that many targets. And what targets they do have are really specific to a viral family or even to a specific virus. So it's not like you can easily repurpose a drug that's used on one virus on another. So it takes time to actually design a drug that's going to work specifically against the virus target. And that's what happened with drugs like, for example, Pfizer's Paxlovid. We had drugs like remdesivir that were Ebola drugs that were repurposed that had some marginal value. There seems to be more value if you give it up front early as an outpatient, but it's very hard to come up with an antiviral on the fly. It takes a lot of what's called rational drug design, where they look at the enzyme they're targeting and they make something that specifically binds to it. So that's why there wasn't. When we tried, everybody hoped that we were going to be able to repurpose a drug and have it be effective. Remdesivir gave us some hope, but many of the others faltered. It's just that drug development is very different than many other elements of pandemic response. And that's why there was nothing in the very beginning that actually targeted the virus. But we're getting there. And I think people are very hopeful that this Pfizer drug could be game changing.
I'm told, and you can clarify this because you know way more about this than me or anybody listening, that the Japanese are using ivermectin and their cases are going way down. Is this true? Is this just false by the internet podcasters, or what's going on with all this?
So it is false that ivermectin is being widely used in Japan. There have been some rumors about that and misinformation, but no, it's not an accepted treatment in Japan or an accepted treatment anywhere for COVID-19, despite many people trying to promote it that way. The clinical trial data really shows it's ineffectual. It is a drug that's important for the treatment of parasitic diseases. In some of the trials where they may have seen benefit, could have been in areas where there was a high parasite burden and you were actually treating an underlying parasitic infection that was undiagnosed along with the COVID. So ivermectin is not something I recommend or would treat anybody with. There is less evidence even than ivermectin for hydroxychloroquine, which has been really disproven as any kind of benefit. It would have been great if these drugs would have worked, but they don't work. And unfortunately, they've gotten wrapped up in politics and they continue to be promoted. And people use them in lieu of things that do work, like the vaccines, like the monoclonal antibodies. That's what we need to be promoting, not drugs that have been shown not to work. And I think it's really put us back when it comes to the pandemic and our response, because we've spent so much time focusing on drugs that didn't work.
When President Obama was president, he did leave a playbook for this kind of scenario. President Trump got in there, he got rid of it. Do you believe if that playbook was in place, I know we're kind of playing Monday morning quarterback with this question, but do you believe if that playbook was in place from President Obama to President Trump, that we would have been in a hell of a lot of a better place than we are now?
We certainly wouldn't have been in a worse place if you would have seen pandemic preparedness taken seriously by the Trump administration. But we know that the Trump administration cut people from the national security staff that were working on pandemic preparedness. And many presidents have had playbooks. Pandemic preparedness has been something I've been advocating for since at least 2008. And before that, my colleagues have been doing it for over 20 years. This is something that is very hard to get politicians to pay attention to because it's thought of as a theoretical risk, not something tangible. It's something that's out there. And I think the 2009 H1N1 pandemic, because it was less severe than people anticipated, it got people complacent. And pandemic preparedness is not something that many politicians or policymakers are very interested in spending money on it because it involves long-range thinking. It's not just an election cycle, and it's nonpartisan. All of that makes it very hard to gain traction. And in general, when it comes to infectious disease emergencies, we find the government to be very reactive. They don't like to be proactive. So even if that playbook was there, I think we still would have faltered just because this is a very hard sell for many politicians to take seriously. But certainly the fact that pandemic preparedness was not valued by the Trump administration prior to the pandemic, and that they had depleted some of the resources at the national security staff does explain how dismal some of the first weeks and months of the pandemic response were. And I think it only could have gotten better if they would have been much more proactive and taken that playbook and actually started to think about it, even if they wouldn't use everything in it. Just having that kind of plan in place or putting importance on the field of pandemic preparedness would have been greatly appreciated when it came to the pandemic response.
I want to move into the COVID vaccines, Doc. You know, I've been told this, and again, this is all about correcting the record and making sure we get out the factual information, that the COVID vaccines are more for the Wuhan variant, and they really don't work well on the variant now of Omicron in general.
It is true that the vaccines that we have been directed against the Wuhan version or the original version of COVID-19 that appeared. And when it comes to their ability to protect against Alpha, Delta, Omicron, whatever it may be, there has been some erosion in their ability to protect against mild disease. But where it counts, protection against serious disease, hospitalization, and death, our vaccines, even though they're directed at the Wuhan version of this virus, are still able to protect us from dying, protect us from being hospitalized. And that's the most important thing that the vaccines do. We may need to, at some point, update these vaccines, or they may be second generation vaccines. But when it comes to what counts, our current vaccines are the best way to keep yourself out of the hospital from COVID-19.
I was watching something online, and there was some doctors that said if we keep getting boosted, whether it's, you know, third, fourth, fifth, sixth, you know, how many of these we need to get through this, that it'll eventually hurt our immune system to fight off viruses in general. Is that true or false?
It's false. There's no evidence that getting boosted is going to hurt your immune system. There is some theoretical talk about getting boosted against the original strain if that blunts your ability to make antibodies to newer strains, but that's separate. There's no damage being done to your immune system by getting boosters. That's just false.
Okay, thank you for answering that. You know, we have a lot of people that listen, obviously, of the younger generation, 20s or 30s. Some are vaccinated, some are not. Why should healthy people that work out, maybe they're in good shape, get vaccinated? Can you tell them?
You should get vaccinated because why would you want to have COVID-19, even if it's going to be a mild case for you? Because it's going to disrupt your life. You're going to get symptoms. You're not going to feel well. You're not going to be able to enjoy your activities of daily living for at least 5 days or maybe more. You could be one of those rare individuals who gets long COVID. You could actually pass this infection, especially Omicron, onto somebody that's immunosuppressed, maybe a grandparent, maybe somebody that you visit that's immunosuppressed. So why would you want to even get in that position when the alternative is to take a safe and effective vaccine that basically reduces that risk significantly? So I do think everybody should be vaccinated, even if they're not at risk for severe disease, because I think there's benefits to your individual life to being vaccinated, because why would you want to be sick when you can avoid it?
Right. Fair enough. I did get the Moderna vaccine, and speaking about that, we saw that some countries have stopped using Moderna due to myocarditis. Also Johnson & Johnson with the blood clots. And that's what I'm hearing from a lot of millennials that I speak to, that I'm friends with, or that listen to the show, of why they shouldn't get the vaccine and why they're not getting the vaccine in general. What would you tell them about that safety issue?
The vaccine is extremely safe and effective. And yes, there are side effects. Every vaccine has side effects. But when you look at the risk-benefit ratio, it favors the vaccines. Now, specifically with the Moderna and myocarditis risk, this is something seen not in everybody, but in people that are in their late teens to 20s. In males only. So that means that females should be getting the Moderna. If they're worried about myocarditis, it doesn't necessarily apply to them. And it's more likely to occur with the second dose. And you can likely space that second dose out more than 4 weeks, maybe do it at 8 weeks or 12 weeks, and you reduce the myocarditis risk. So this myocarditis risk it does exist, it is real, but I think it's manageable. And again, it only applies to a specific segment of the population, not to everybody. The same is true for J&J's blood clotting disorder. That only seems to apply to women of childbearing age. So if you're a male, there's no reason that you should be worried about that when it comes to the J&J vaccine. And then again, we also have the Pfizer vaccine, which has less of a risk of either of those problems. So there's a menu of vaccine options, and whatever side effects there are, they're navigable if people actually want to be vaccinated. And I think physicians have an ability to guide people towards the vaccine that might be best for them, or to help them modify those risks, or talk about those risks in a way that really demystifies them, so they're not so scary, and that they come out, they show them to be as rare as they really are and as manageable as they are.
So this person writes to me that they got the first shot in March, second shot in April, the first week of April. About 2 weeks after that, they started seeing dizziness, anxiety issues. This has been going on since April. They said they've been to the hospital 5 times. They've been to a cardiologist, a neurologist. The neurologist says they think it's from the vaccine, and so did an ear, nose, and throat doctor. What would you tell this person?
I haven't seen any reports of something like that, but I think that it's important to get these types of side effects investigated. Like I said, every medicine, everything we do has some level of risk. There's always going to be some side effect, but you have to weigh that against the benefit. And I don't know if this person's symptoms are actually causally linked to the vaccine or it's something else. But I think in general, these types of reports are very rare. I know they are very compelling, especially to the person that's experiencing them, but they're not the norm to expect. We've given hundreds of millions of doses of these vaccines all around the world, and the risk profile is very, very low. But that doesn't mean it's zero. But these side effects that are occurring are in general mild and manageable. And I wouldn't be dissuaded by hearing one anecdote from the value of these vaccines, even though that person should have their case investigated to understand whether or not it was linked to the vaccine or not.
Yeah. Last question, Doc. I don't want you to play God or anything, but we hear on the news that Omicron, obviously no one wants to get sick. I agree with you 100%, but Omicron is very mild if you do get it. A lot of people are saying, and I've talked to virologists at the University of Ottawa over in Canada, he said he thinks maybe this could be coming to an end within the next 6 months. What is your stance on this? Are we looking at Omicron as coming toward the end of this pandemic and it'll be an endemic, or is this going to just keep going?
I do think that Omicron is a sign of the times ahead, that the virus is developing the ability to get around immunity from natural infection, to get around immunity from vaccines, and infect us at will. That's reminiscent of what the other 4 coronaviruses that cause 25% of our common colds do. And I always thought that this is going to be the 5th seasonal coronavirus. I think Omicron is taking a step down that path, but I wouldn't say that it's mild yet. It's mild in some people, but Omicron can still kill, especially if you're an unvaccinated high-risk person. Omicron is a clear and present danger to you. So I think it's important to put that mildness in context, that it can still be deadly. But I do think we're going towards endemicity. Hopefully this Omicron cycle lasts only a week or 2 more here in the United States, and we get to a better place with antivirals, monoclonal antibodies, more vaccines, more diagnostic tests. But we will get to a point where we have to navigate our lives and risk calculate in a world in which COVID-19 is ever present, but a milder version of COVID-19, milder because of the tools science and medicine have given us, particularly the vaccines. But there's not going to be a COVID zero. We're not going back to 2019. The virus is not going back into bats. So we have to be able to come up with a sustainable approach to living in a world where there's a new virus that's an everyday threat to us. And I think that we have the tools to be able to do that. We just need more people to use those tools.
Right. Doc, thanks so much for your time. Where can people find more about you and learn more about you?
So I'm a senior scholar at the Johns Hopkins Center for Health Security. You can look at the Center for Health Security website. I'm also active on Twitter. My Twitter handle is @Amesh AA, so AMESH AA, and I have a website called Tracking Zebra as well.
Dr. Amesh Adalja. Thanks so much for your time, and I really appreciate it.
Thanks.